Imagine the sharp bite of a flint blade cutting into your flesh. No numbing, no sedation, just the raw, searing pain. For most of human history, surgery was a brutal last resort. But ancient people were not helpless. They had a hidden arsenal of pain-fighting tools. From the opium poppy to the coca leaf, from alcohol to acupuncture, ancient civilizations developed sophisticated methods to manage surgical pain. The opium poppy was one of humanity's earliest and most powerful allies against pain. Sumerians called it the joy plant as early as 3400 BCE. They cultivated it and used its milky sap to soothe crying babies and calm surgical patients. The knowledge spread to Egypt, where the Ebers Papyrus, a medical scroll from 1550 BCE, lists opium as a remedy for pain. Greek physicians like Hippocrates also In South America, the coca leaf was the key to pain relief. The Inca and their predecessors chewed coca leaves mixed with lime to release alkaloids that numbed the mouth and stomach. For trepanation, drilling holes into the skull, coca was essential. Archaeological evidence shows skulls with healed edges, proving patients survived these operations. Coca's active ingredient, cocaine, would later revolutionize modern anesthesia. Alcohol was another universal anesthetic. Ancient Egyptians, Greeks, Romans, and Chinese all used wine or beer to dull pain before surgery. The patient would drink heavily until stupor set in. It was crude but effective for short procedures. Meanwhile, in China, acupuncture developed as a precise method. By inserting fine needles at specific points, practitioners could block pain signals. The Yellow Emperor's classic of internal medicine, from around 2600 BCE, describes its use for surgery. One of the most common ancient painkillers was alcohol. Wine, beer, and spirits were used to dull the senses before surgery. In ancient Egypt, patients were given wine mixed with opium poppy juice. The combination created a powerful sedative effect, allowing surgeons to perform. Another method was the use of pressure on blood vessels. Ancient Greek and Roman surgeons would compress the carotid arteries in the neck to induce unconsciousness. This technique, known as carotid sinus massage, could cause a temporary loss of consciousness, but it was risky and could lead to stroke or death. Herbal remedies were also widely used. The mandrake root, for example, contains alkaloids that can cause sedation and hallucinations. In medieval Europe, patients were given a sponge soaked in a mixture of mandrake, opium, hemlock, and other herbs. The sponge was dried and then rehydrated before use. This soporific sponge was held under the patient's. Psychological techniques were just as important. Surgeons would work quickly, often using distraction or sudden movement to surprise the patient. In some cultures, patients were given a blow to the head to knock them unconscious. Others used hypnosis or rhythmic drumming to induce a trance-like state. The goal was always the same: to reduce the agony of the. How did they endure the pain? Imagine a Neolithic hunter with a fractured skull from a fall or a fight. Without surgery, he would die. But with trepanation, he had a chance. The surgeon would first scrape away the scalp, exposing the bone. Then, using a sharp flint tool, he would carefully cut a groove around a small circle of skull. This could take hours. The patient was likely awake, held down by assistants. To dull the pain, they might have used herbal remedies like willow bark, which contains salicylic acid, a precursor to aspirin. Or perhaps they used alcohol or simply relied on the patient's will to survive. But trepanation wasn't just for physical injuries. Many skulls show no signs of trauma. This suggests the procedure was used for spiritual or medical reasons, to treat epilepsy, migraines, mental illness, or to release evil spirits. In ancient Greece, Hippocrates described trepanation for head wounds and blindness. In the Andes, trepanation was performed with bronze tools, and survival rates were as high as 70%. The Inca even developed specialized surgical instruments, including tumis, a type of knife. They also used bandages. The procedure itself was remarkably consistent across cultures. The surgeon would cut a circular or rectangular piece of bone, then lift it out. The hole was sometimes covered with a metal plate or a piece of gourd. In some cases, the removed bone disc was worn as an amulet to ward off evil. Healing took weeks, and the patient had to avoid infection. Surprisingly, many patients survived and lived for years. Archaeologists have found skulls with multiple trepanation holes, indicating repeated procedures. One trepanation persisted into the Middle Ages. In Europe, barber surgeons performed it for head injuries and epilepsy. They used specialized tools like the trephine, a circular saw with a central pin. The procedure was brutal but often necessary. By the 18th century, trepanation evolved into modern neurosurgery, yet the ancient practice never fully disappeared. Even today, some people practice trepanation for spiritual reasons, claiming it expands consciousness. But modern medicine warns against it. Drilling a hole in your skull is extremely dangerous and can cause from pressure on the brain, but the pain of the operation itself could kill him from shock. Survival depended on controlling that pain. The earliest known painkiller was simple: alcohol. Fermented drinks like beer and mead were used to sedate patients before surgery. Alcohol depresses the central nervous system. In high enough doses, it can cause unconsciousness. But it's a dangerous tool. Too little does nothing, cause respiratory failure or death. The margin between sedation and overdose is razor-thin. For centuries, surgeons had no better option. They would pour alcohol down a patient's throat, wait for stupor, then cut. It was brutal, but it was the only way. Then in the 19th century, a new era began. In 1846, at Massachusetts General Hospital, a dentist named William T.G. Morton publicly demonstrated the use of ether as a surgical anesthetic. A patient inhaled the vapor and fell into a deep, painless sleep. The operation was a success. The ether and chloroform revolutionized surgery. Pain was no longer an obstacle. Surgeons could operate slowly, carefully, and for longer periods. But these early anesthetics had serious side effects: nausea, vomiting, and in some cases, cardiac arrest. The search for safer alternatives continued. In the 20th century, scientists developed local anesthetics like Novocaine, which numbed only a specific area. Then came intravenous agents like thiopental, which induced unconsciousness in seconds. Today, anesthesiologists use a cocktail of drugs tailored to each patient: one for sleep, one for pain relief, one to paralyze muscles, and another to reverse the effects after surgery. Anesthesia is one of the greatest achievements in medical history. Before its discovery, surgery was a desperate, agonizing gamble. Today, millions of people undergo operations every year without feeling a thing. The control of pain has transformed not just medicine, but the human experience of suffering. It is a reminder that even the most basic problems, like the pain of a knife cutting into flesh, can be solved with ingenuity and science. The next time you go under the knife, you can thank the pioneers who dared to put people. Nevertheless, alcohol remained a staple of surgical pain management for thousands of years. The ancient Egyptians, Greeks, and Romans all used wine as an antiseptic and a sedative, but alcohol alone wasn't enough. Ancient healers turned to plants. The most powerful was the opium poppy. Cultivated since 3400 BCE in Mesopotamia, it was called the plant of joy. Opium contains morphine, a potent painkiller. The Sumerians, Egyptians, and others used it for surgeries and rituals. But opium had side effects: addiction, respiratory depression, and overdose. Healers knew its dangers but had few alternatives, and Greeks used it for surgery. The Greek physician Dioscorides described its use for pain relief in the 1st century CE. Another powerful plant was mandrake. Its root resembles a human figure, and it contains alkaloids that cause sedation and amnesia. It was used as a surgical anesthetic in ancient Greece and Rome. The Roman author Pliny the Elder wrote that a piece of mandrake root given before surgery could dull the pain and make the patient sleep through the operation. Cocaine numbs nerve endings. The Inca also used alcohol and a plant called vilca to induce unconsciousness. Their success rate for trepanation was surprisingly high. About 70% of patients survived the procedure. This high survival rate suggests that Inca surgeons had developed effective methods to control infection and bleeding. They used antiseptic herbs like coca and saponins from the quille tree to clean wounds and prevent infection. The Ebers Papyrus, dating to around 1550 BCE, is one of the oldest and most important medical documents ever discovered. It contains over 700 remedies for various ailments. Among them is a recipe for a pain-relieving poultice that includes opium, coriander, and honey. This shows that even in ancient Egypt, people understood the pain-killing properties of the poppy. Another recipe in the same papyrus suggests using the poppy plant directly to soothe pain. The Egyptians called the poppy the plant of joy, or the sleep bringer. They used it for headaches, wounds, and to calm crying children. This early use of opium laid the foundation for its spread across the ancient world. Around 400 BCE, the Greek physician Hippocrates, often called the father of medicine, wrote about using the juice of the poppy to treat pain. He described it as a powerful remedy for internal pain, especially for women during childbirth. Hippocrates' writings show that the medical use of opium had spread from Egypt to Greece. These ancient records are not just stories. They are physical evidence of how early civilizations discovered and used opium. The Ebers Papyrus and Hippocrates' texts survived for thousands of years, buried in tombs or copied by scribes. They prove that the search for pain relief is as old. He also recommended wine and mandrake for surgical procedures. Archaeological evidence also supports these texts. Residue analysis of ancient vessels has found traces of opium, cannabis, and alcohol. In Cyprus, a 3,500-year-old jug contained opium residue. In China, the earliest known medical text, the Huangdi Neijing, 200 BCE, describes using acupuncture to relieve pain. Acupuncture may have been used for surgical analgesia. Acupuncture is thought to release endorphins, the body's natural painkillers. While its effectiveness for surgery is debated, it shows ancient understanding of pain pathways. But ancient pain relief had serious limitations. Dosages were imprecise. Too much opium could stop breathing. Too much alcohol could cause alcohol poisoning. Moreover, many procedures were still excruciating. Amputations, for example, were done with a saw while the patient was held down. Pain relief was often The Roman medical writer Celsus described 4 classic signs of inflammation: redness, swelling, heat, and pain. He also recommended treatments like cold compresses for fresh injuries and warm compresses for chronic conditions. Galen, the most influential physician of antiquity, built on Hippocrates' humoral theory. He believed health depended on the balance of 4 bodily fluids: blood, phlegm, yellow bile, and black bile. Disease was Galen's treatments included bloodletting, purging, and dietary changes. He performed surgeries and dissected animals since human dissection was forbidden. His anatomical knowledge, though flawed, dominated medicine for over 1,000 years. But Galen's authority also stifled progress. For centuries, doctors trusted his writings over direct observation. If Galen said the human liver had 5 lobes, they accepted it, even though it actually has 2. This blind faith would last until the Renaissance. The Roman medical system also included public health measures. Aqueducts brought fresh water and sewers carried waste away. Public baths promoted hygiene. These measures likely reduced disease more than any physician's treatment, yet Roman medicine remained limited. Germ theory was unknown. Surgery was performed without anesthesia. Most people relied on folk remedies, prayers to gods like Asclepius, or visits to healing temples. Medicine was a mix of science, abandoned, but the quest for painless surgery continued. In 1844, a dentist named Horace Wells attended a laughing gas exhibition. A volunteer inhaled nitrous oxide and injured his leg without feeling pain. Wells immediately saw the potential. He tested the gas on himself, then used it to extract a tooth. The patient felt nothing. Wells was ecstatic. He arranged a public demonstration at Massachusetts General Hospital. The demonstration was a disaster. The patient, a young man named Gilbert Abbott, inhaled the gas, but Wells miscalculated the dosage. Abbott remained conscious and cried out during the incision. The audience jeered. Wells was humiliated. He was labeled a fraud. The medical establishment dismissed anesthesia as a dangerous fantasy. Wells sank into depression but Wells's failure did not end the story. His former partner, William T.G. Morton, had been watching. Morton believed a stronger agent was needed. He experimented with sulfuric ether, a chemical known to cause unconsciousness. On October 16, 1846, Morton administered ether to Gilbert Abbott, the same patient from Wells's failed demonstration. This time, Abbott slept peacefully through the removal of a tumor from his jaw. He woke up and said he felt no pain. The news spread like wildfire. Within weeks, ether anesthesia was used in surgeries across Europe and America. Pain, the ancient enemy of surgery, had been defeated. Morton tried to patent his method, but the secret of ether was too simple to keep. The age of modern surgery had begun, yet Wells, the pioneer, never saw this triumph. He died by suicide in 1848 at age 33, unaware that his idea had changed the world. Abandoned due to its dangers. Despite these risks, ancient surgeons continued to innovate. They understood that pain was not just physical but psychological. They used rituals, music, and even hypnosis to calm patients. One of the most surprising ancient techniques was psychological. The Greek physician Galen used suggestion to reduce pain. He told patients that a certain herb would make them feel no pain. This is an early form of what we now call the placebo effect. The mind, they realized, could be a powerful ally in healing. This understanding was lost for centuries, only to be rediscovered in modern times. Modern medicine now embraces the mind-body connection. Techniques like meditation and cognitive behavioral therapy are used alongside drugs. The ancient insight that belief can heal is now backed by science. Of the placebo effect, belief in the treatment can trigger real physiological pain relief. Ancient healers exploited this power. In ancient Egypt, priests performed elaborate rituals before surgery. The patient was told the gods would protect them. This reduced fear and anxiety, which in turn reduced pain perception. In India, the Sushruta Samhita, 600 BCE, describes using wine to induce a state of intoxication before surgery. The patient would drink wine or inhale cannabis vapors to dull the senses. This early form of anesthesia relied on the patient's altered state of consciousness, but also on their belief that the procedure would be painless. The Sushruta Samhita also details surgical procedures like rhinoplasty and cataract surgery. The patient's belief in the surgeon's skill and the ritualistic preparation contributed to successful outcomes. The placebo effect was not understood, but it was harnessed. The placebo effect is not just mind over matter. It is a measurable neurobiological phenomenon. Endorphins and dopamine are released when a patient believes they are receiving treatment. This ancient wisdom, that belief heals, is now confirmed by modern science. Was also given a mantra to repeat, focusing the mind. Sushruta is considered the father of plastic surgery. He performed rhinoplasty, nose reconstruction, using a forehead flap. He used wine and cannabis for pain relief. The use of cannabis as an anesthetic is documented in ancient China and India. It was often mixed with wine to create a potent sedative. So how effective were ancient pain management techniques? The effectiveness of ancient pain management varied greatly. Opium poppy was used in Mesopotamia and Egypt. The Ebers Papyrus from 1550 BCE describes a remedy for pain. To stop the crying of a child, take the seeds of the poppy, mix with fly dung, and apply to the child's head. This shows that while they had powerful substances, their application was often mixed with superstition. In ancient Greece, Hippocrates prescribed willow bark for pain, which contains salicin, a precursor to aspirin. But dosage was inconsistent, and many treatments were based on. Despite these limitations, ancient surgeons achieved remarkable success. Trepanation, drilling a hole in the skull, was performed successfully in many cases. Evidence from ancient Peru shows that up to 70% of patients survived the procedure. They used tools like the tumi, a ceremonial knife, and applied bandages and antiseptic herbs. The Incas also used coca leaves as a local anesthetic, chewing them and applying saliva to the wound. This shows a sophisticated understanding of pain relief, even if they didn't know the chemical mechanisms. The legacy of ancient pain management is profound. Many of their discoveries, like opium and willow bark, evolved into modern medicines. The concept of using natural substances for anesthesia paved the way for ether and chloroform in the 19th century. Today, we still use derivatives of these ancient remedies. Morphine, codeine, and aspirin all have roots in ancient practices. So, while their methods were crude by modern standards, the ancient world laid the foundation for the pain relief we rely on. Evidence suggests they were surprisingly effective for certain procedures, but far from modern standards. Trepanation survival rates in the Inca Empire were around 70%, comparable to some modern neurosurgical procedures in the 19th century. This shows that pain control was adequate for survival, but many patients still suffered immensely. The pain of surgery was a barrier that limited what ancient surgeons could attempt. They avoided long, complex procedures. Instead, ancient surgeons focused on quick, targeted interventions like draining abscesses, setting bones, and removing surface tumors. These limitations meant that internal surgery was rarely attempted. The risk of infection and uncontrolled bleeding was too high. Ancient medicine had to work within these harsh realities.